And I went live on our YouTube page too.
Great.
You see it on there?
You see it?
Go.
Yeah.
I can hear me.
She intended.
Go up to my calendar.
4. The 2 attendees.
Is your speaker inside?
Joined. Maybe I think I see 2 attendees. I'm trying to click on. Oh no, not yet. That's a message. So, I think she'll be joining soon. Phone check with it too.
Oh, it won't let you in that way. Did you go to the calendar and just sign in the Zoom?
Yeah. Be awesome. No. Or not. Yeah. She made you. Let's see. 7. 5. Oh yeah, she's here. So she just joined. Promote panels. Hey, how are you?
This Zoom, you know, it never works well when you need it.
What's going on, girl? Let me introduce you to my executive director, Vanka Hall. This is my dear friend and colleague, Dr. Ferdinand. How you doing, sis?
How are you? It's good to meet you.
You too.
So you turned the volume.
Can you still hear me?
Mm-hmm.
Yep. Can you hear us?
Yes, it's some noise. You know, I'm here in New York City in my background, so I'm trying to see what's the best. If you guys can hear me good.
Yes, we can hear you good. It's coming through well.
Okay.
Nice.
So when she gets on, she will answer that.
Yes.
I'm sorry.
Dr. Williams, I'm ready whenever you are.
All right, let me go ahead and record. All right, we are ready. Let's go. Welcome, everyone. I want to welcome you to our April spring health disparities, social determinants of health speaker series. And I want to welcome all of you to our session this month, and want to extend a warm welcome to my dear friend and colleague, Dr. Renata Ferdinand, who's the chair and full professor, Department of African American Studies, New York City College of Technology, CUNY system. Very accomplished scholar who has researched. She writes autoethnographies that explore the complexities of the lived experiences of Black women and girls, from how race and gender impact experiences within the healthcare system to colorism, racial stereotypes, and Black women's identity. Her work has been featured in a number of different outlets, including the Popular Culture Study Journal and the International Perspectives of Autoethnographic Research and Practice, Black Love, the Intimacies and Intricacies of Romantic Love and Black Relationships in Space and Culture, the journal. She has given several talks on Black motherhood studies and Black girlhood studies, and recently was featured as literary expert for an article, Reblazing Saddles, Who Shapes the Wild West Lit Canon. And she has a recent work in autoethnography of African-American motherhood, things I tell my daughter through Routledge Press. She's just a phenomenal scholar, an incredible human being, and I appreciate her friendship and sisterhood. And I'm so glad that she can be with us today. And she'll be talking on the subject, social barriers to a life well lived, the nuances of being Black and female. And without further ado, I want to turn it over to my dear friend and expert and scholar, Dr. Renata Ferdinand. Welcome.
Thank you, Dr. Williams. Thank you for having me. I'm very excited to be with you guys today. So I wanted to speak briefly about, the title that we have here, the nuances of being Black and female. And one of the things was, when I talk about this subject, I like to ground the audience in just the premise that I'm working off of, so we can all be on the same page. And so I feel it's important that I state that Black women and girls face struggles in their lives that their non-Black peers face. And that's important for us to understand, to move about this conversation in understanding that premise. The other thing that I'm working off of is that gender equity and racial equity are inseparable. You can't tackle or talk about or address one without addressing and talking about the other. Some of the issues that face Black women and girls are very similar, right? Because we know the society that Black women and girls exist in, and some of them are different. So in the way that they, these issues that affect Black girls, there are issues that affect Black women, but they manifest themselves in a different kind of way. And so I'll give you an example of that. So Black girls suffer from adultification, and research shows that people perceive Black girls to be older than they actually are. And we've seen this throughout society. And one place that I want you to think about is during the Philando Castile murder in 2016 in Minneapolis. When we look at how the news coverage and society structured the killing of Philando Castile, he wasn't in the car alone, right? He was in the car with his fiance and her 4-year-old daughter. But what we saw from the response was newspaper articles talking about the behavior of the 4-year-old, right? And they used language that you would normally attribute to a grown woman, that she was mature and how she held herself. And it was as if they forgot that this was a 4-year-old girl. So when we think about adultification, we see this in all aspects of our life, of how Black girls are perceived to be older, more mature, and it's all kind of ramifications that come from that labeling of Black girls. In Black women, we see the manifestations of stereotypes, and these stereotypes cannot be underestimated when we think about how society kind of deems Black women in these stereotypes that are so truly harmful, the impact of these stereotypes. And so I'm going to talk more about that as I progress. While I was doing this, preparing for this presentation, I was just looking up things about Ohio, what's the state of Black womanhood and Black girlhood in Ohio? And, I ran across some very disturbing facts. In 2020, the Bloomberg City Lab report ranked Cleveland as the worst city in America for Black women. And so off the bat, we're in a state in 2020 that was ranked the worst city in America for Black women. So what does that mean? What does that look like? When we look at the data, it looks like there's an economic difference, right? Black women, just kind of typically across the country, but specifically when I'm looking at the data for Ohio, Black women are paid less than their male and female counterparts. In a lifetime wage gap, Black women have to work until they're the age of 83 to make what a white man does by the age of 60. So when we think about the gap in the age there. And so because Black women tend to make less in Ohio, there's a cyclical kind of thing that comes from that, right? So we have economic conditions, and these economic conditions can also affect their access to healthcare, which is a problem. And then this spirals into other problems. They're more likely to die from cardiovascular disease, hypertension, stroke. And we know across the country that Black women are more likely to die in childbirth than their non-Black peers. But in Ohio specifically, Ohio has the 6th highest rate of maternal mortality in the country. So we have to think about what that looks like. And so for Black women in Ohio, the rate is 112.2 of the maternal mortality rate compared to 60.5 and 67 for white and Hispanic women. So when we think about the state of Black womanhood, Black girlhood in Ohio, we already are seeing a problem. It reminds me of in 2021 when Ma'Khia Bryant was killed, 16 years old, killed by a police officer. And so many of you may have seen this in the newspaper. And what we have to think about, what are the conditions that allowed something like this to even take place? Like, what is this world that Black women and girls are living in? And so when we look at specific things, right, when we look at the educational system, we know that the educational system largely excludes Black girls from mainstream education because they're penalized in mainstream education. Like research has showed this. We find things like African-American girls being suspended at an alarming rate, much more so than their peers, put in school suspension. Things like that, detention. So we know that this is what Black girls, the things that are happening with Black girls, this is the effect of it. This is what it looks like. Because oftentimes we can see all of these numbers, right? And we can see all the figures and the facts, but if we don't know what it looks like, right? How it shows up in someone's life, we're doing a disservice to someone. So in schools, we know this happens to Black girls. Right? We know when Black girls are penalized for things like their hair, right? Things like not wearing a belt. We've seen the cases. And the thing that's significant about the hair is if you have an understanding of how important the role that hair plays for Black women and girls, then you'll have a sense of why hair is important. But things like suspending Black girls for certain hairdos, those that are deemed unacceptable. So we have to think about that kind of thing because research is showing or indicating that if you can tame a Black woman through her hair, you can tame her. And it's something about that we see that structure in the educational system. So we're also seeing in education, Black girls are being led away from academic success and professional success, and rather they're led toward a school to prison or a school to low wage work pipeline. So there's a pipeline that's channeling and trying to funnel our girls into this kind of system. So this is how this manifests in the lives of Black girls. And so in terms of stereotypes for Black women, we already know, Patricia Hill Collins has taught us that Black women operate in this matrix of domination, right? Racial structure, societal structure, especially a policing structure that influences and impacts the lives of Black women. And we know the stereotypes and all their derivatives, the mammy, the matriarch, the Jezebel, the welfare queen, we all know about and have seen these things. But again, what does it look like in our lives? How does this manifest in our lives? So we have this situation where these stereotypes, as Bell Hooks shows us, are substitutes, but they stand in for the real, and that's what makes them so dangerous. They're not only substitutes, they're standing in for the real. So these images that have followed and plagued Black women, all of our lives, when we think about these images, it makes us hyper visible and invisible at the exact same time, right? So we know that Black woman's body is always on display. It's always on exhibition. It is never to itself. It always has meaning, regardless of the room that you walk into. And so we see this invisibility and this hyper visibility because they're visible because they're being seen through stereotypes, but they're invisible, right? And we see this throughout history. I think immediately about Henrietta Lacks and the HeLa cells that were taken from her in 1951 without her knowledge, and how her cells have led to developments and for treatment for cancer, for treatment for infertility. And she didn't even know. And her family didn't even know. And even to this day, her family lives in poverty in Baltimore, Maryland, and they can't even get health insurance, even though their ancestor has made that kind of contribution. So we're able to see and pinpoint all these places where we're seeing how these stereotypes and things of that nature impact and affect Black women. So one thing that is oftentimes talked about when we're talking about these issues are a subset of other issues that affect Black women and girls. And one of the reasons why I'm emphasizing all of these kinds of things is because we have to understand the social and cultural world that Black women and girls live in before we can assess anything, right? Before we can do any research, before we can have any kind of understanding of their educational system, before we can understand how to treat them, even if you're a medical professional. You got to understand their social and cultural context because you're not treating them in isolation, right? We don't exist in isolation. So one of the things that is important, so we have these things like skin, hair type. We have skin color, right? The idea of colorism, that certain skin colors are privileged more so in this society, in this society than in others. And so when you think about the effect that this has on Black women, again, especially because women in this society, their worth in this society is tied to their beauty. Right, those go hand in hand. So we're seeing, and the research shows this, that connection between their beauty and their value and their significance. And so in this society that we live in, there's a preference for lighter skin, right? This is where colorism comes into play. We see it in advertisements, billboards, movies. We see this a lot. But what does this look like in the life of a Black woman, especially if she's dark skinned, right? And the research shows you're darker skin, especially you're a woman, you're considered less attractive, you're considered less intelligent, you may make less, you're less successful. And we see it in employment. Research is finding this in socioeconomic standing. It's also finding this in the sentencing, right? If you're in court cases. And so when you have to think about this world that Black women are moving within, and then as we see this same kind of thing manifest in Black girls, we have to think about what this looks like for Black girls. And, before all the remakes of the Disney princesses, before then, all of them were white. So what does this do to a Black girl from a very young age who's been bombarded with these images, right, of these Disney princesses, where none of them look like her. So there was no Black Cinderella or Rapunzel or Snow White or Ariel, any of those people. So what does that look like? What's the effect? Right. And we know all the studies that have been done with the doll tests and things like that, but we're still living in that moment. And I want you to also to consider that even when Disney came out with the first Black princess in 2009, she spent the majority of the time on screen as a jumping amphibian, right? She was a fraud for most of that. She very seldom showed up as an actual princess in the movie. So when you think about those kind of things and how they affect Black girls, we have to think about Toni Morrison's work, The Bluest Eye. I immediately think of Pecola Breedlove's when she asks, "Oh, what made people look at them and say, "Ah, but not for me," right? I'm immediately reminded of why she did that. So when we think about this social and cultural world that these Black women and girls are trying to navigate every day, daily interactions, and sometimes, it doesn't take a big racist moment to throw you off of your day. It's sometimes the smaller things that dig at you, right? That pull at you. So we think about these things that they're navigating. And so what I do in my research is I tell stories. And I try to make the connections amongst different stories. So I'm going to give you a definition of autoethnography because that's what I do. Autoethnography is setting a scene, telling a story, weaving intricate connections among life and art, experience and theory, evocation and explanation, and then letting it go, hoping for readers who will bring the same careful attention to your words in the context of their own lives. And so I say that, and I want to read to you one of my more recent publications that kind of came out during COVID that kind of illustrates all the things that I'm talking about today. And I want you to pay attention to the 3 different names that you will hear being spoken. I can't get the image out of my head. Her hair gently swept into 2 pigtails aligning each side of her face. Those brown eyes, soft but penetrating, and that perfect smile. Who can forget it? I look at this picture and see the faint image of my own 14-year-old daughter. There she is, Michaela Robinson, confidently standing in a gymnasium, proudly holding her academic plaques and awards. The straight A student looks bashful, sweet. I see her. I see youth. I see possibilities. I see promise, a future built on her wildest dreams. But it was not to be. On August 14th, 2021, 13-year-old Michaela Robinson died from COVID-19 complications mere hours after testing positive. The Mississippi native was just beginning her 8th grade year at Riley High School. Sadly, she won't experience the glories of high school. No laughing with friends while standing at the lockers in the hallway. No playing the flute at the big homecoming dance. No dances, period. Not even the 8th grade prom. But that smile, teeth so straight and sparkling white, I look at this smile and I think of how unfortunate it is that I'm even able to see it. See, Mississippi doesn't have a mask mandate. One day before Michaela's death, Governor Tate Reeves specifically stated, "I don't have any intention of issuing a statewide mask mandate for any category of Mississippians at this time." Even though the Smith County School Board began requiring masks on Tuesday, August 10th, 4 days before Michaela's death, it was much too late. Michaela was sick by that Thursday, and ultimately she died from the illness the following Saturday. I'm left thinking of the words of her mother, Michael Robinson. "I touched her, I talked to her, and her pulse came back. I turned and left, she coded again, and that's the last time I saw her." Unfortunately, Michaela's death is not rare. As of September 2021, Mississippi leads the nation in COVID-related deaths, having recently surpassed New Jersey. Early on, Black Mississippians accounted for 72% of all Mississippi deaths, despite being less than 40% of the population. It was only a year earlier that a 38-year-old Black woman, Shalondra Rollins, became the first person to die in Hinds County, Mississippi, after testing positive for the coronavirus 3 days earlier. Two statements that have stayed with me come from her mother. The ambulance was driving like it was a normal day, someone coming home from work. It was no sense of urgency. Can you imagine a 12-year-old in there trying to give her mother a breathing treatment and resuscitate her? That's where my anger is at. The startling image of Shalandra lying in a casket is imprinted in my memory, wearing a light-colored lace dress, a pink bracelet on her wrist. Her grieving mother stands above her with a black mask and blue gloves on her hands. It is an image I wish I could forget. She sat at a fountain with a black and white shirt on, emblazoned with the words, "Just do it." Her long braids flowing down to her black shorts, and that smile beautified by bright red lipstick. Black framed glasses and big gold earrings complete the look. I look at this picture and wonder what kind of person she is. Her words describe her as captivating, as giving and sincere. They say she liked hockey, was a good cook, and loved making beautiful cakes. And she loved her family, especially her nieces and nephews. She liked musicals like Hamilton and simply adored the Harry Potter series, even hosted costume parties of the books. They say she was devoted to her students at Bushwick Ascend Middle School here in Brooklyn. I didn't know Raina Zoe Mungin personally, but I find myself obsessing over the story of her death. I won't recap the grim details here. A quick Google search reveals how major news outlets, including CNN, ABC News, and CBS News, tell the story of her untimely death. Her sister, Mia Mungin, chronicled Raina's battle with COVID-19 on Facebook. I offer here only the basic facts, minus all the flowery language. The gist of the story is she was sick. She went to the hospital for a COVID test. They denied her. 4 days later, she went again. Again, they denied her. She went one more time a day later. They admitted her. Hours later, she was on a ventilator. She died 6 weeks later. She was a fiction writer, having earned an MFA at the University of Massachusetts, where links to her story still exist. But the sad part about Raina's story is they gave her albuterol and medicine for a headache, even though she had a fever, one of the indicators of having COVID-19. When she was still short of breath 4 days later, her family called for an ambulance, who came and again gave her nebulizer treatment with albuterol. According to her sister, they even implied that she was having a panic attack and proceeded to calm her down by talking to her about her goals and dreams. She bravely told the EMS, "My goal is not to die today." But the EMS were not helpful. After treating her, they left for another call. Raina made it to the hospital on her own, where she was eventually admitted as one of the sickest patients in the hospital. I read this story over and over again in all the national outlets that covered it. Although more details emerged, the story is essentially the same. Yet I kept searching. I don't know if I am secretly searching for something in particular, but with each news article I read, a sadness steadily grows in me, and I'm consumed with what ifs. What if she had returned to school to get her doctorate as she one day intended? What if she had met her goal of turning her master's thesis into a book? Admittedly, these are very lofty questions. Maybe a more pressing question is, what if they had listened to her and given her a COVID-19 test? I look at a piece written for her that uses her words. What good is a love of words, writing, and music, and teaching others when it's all filtered through the expectations of my skin? To be beautiful is not the best thing in the world. Being smart is better. To be able to sing is wonderful, but breathing is best. Unfortunately, Raina wouldn't breathe on her own again, at least not for long. The medically induced coma didn't help her breathe. The ventilator she was eventually placed on didn't either. No, even the drug Trump referred to as a game changer didn't help her, nor did the experimental drug, which she only received after a transfer to Manhattan's Mount Sinai Hospital through the urging and advocacy of her family. In fact, it took a public outcry for her family and friends, a rally for her cause on Facebook, and a campaign to write to local representatives to get Raina access to quality care, all in an effort to save her life. Sadly, it didn't. I'm consumed by what if. What if, Arnett writes, some who knew her saw a tragic irony. The very biases that Mungeon, who was Black, sought to bring attention to in her work ultimately played a role in her death. So in those stories that I just read, these women don't know each other, right? They're in different locations in the country. They had different experiences, but they are connected because that's what autoethnography allows me to do, connect the stories. So I'm connecting a story here about the healthcare system and how it failed these 3 Black women and girls. You may ask yourself, how could this happen? Well, I've already told you about the social and cultural issues that affect Black women and girls. But in particular, I want you to note the human and technological biases that occur in the healthcare industry. When you look at some of the things that take place between doctors and patients. For example, in 2016, the University of Virginia medical students and residents revealed that the participants believe that Black patients feel less pain because their nerve endings are less sensitive than white patients. And this was a study conducted at University of Virginia with medical students. So this gives you an idea of how this kind of biases are ingrained, right? It seems to me not to be challenged. Another biases, and this is technological related, the healthcare algorithm Optum was found to show racial bias by favoring white patients for additional care over Black patients, even though the Black patients were sicker and had underlying conditions. All right, so that's technological related. So we always have to remember that there's someone behind these technological gadgets and things of that nature. I remember even not too long ago when Google had biases about Black girls, that when you put the term Black girls in Google, it used to bring up things like prostitutes and things of that nature. So we can't divest the human era in the technological problems that we have in terms of race and class and gender. And then the healthcare industry perceives, and this is again what research has showed, perceives that Black women have a higher tolerance for pain, right? And we know, especially when Black women were enslaved, that the father of modern gynecology, Dr. James Marion Sims, used to perform these medical procedures on Black enslaved women using no anesthesia, right? So when we think about that kind of thing, so all of these are perceptions and biases that impact daily life for Black women and girls. And then there's implicit biases, right? Fitzgerald and Hurst explained the effect of implicit biases in healthcare settings. So implicit bias explain a potential disassociation between what a person explicitly believes and wants to do. Like, for example, you may want to treat everyone equally. And then the hidden influence of negative implicit associations on her thoughts and actions. For example, perceiving a Black patient as less competent and thus deciding not to prescribe a certain medication. So implicit bias is a factor in all of this. And research shows that African Americans are less likely to receive needed services just across the healthcare industry anyway. So if I go back to COVID and think about, like, how did this situation happen? So not only is it the social and cultural world that Black women and girls live in, because we don't exist in isolation. In COVID in particular, the CDC found that there are social determinants factors that contributed to the increase, your increased risk of contracting and dying from coronavirus. And so they came up with 5 of them. It was racism and discrimination, healthcare access and use, occupation, educational income, and wealth gaps and housing. So those are the effects of it. And so we could see, if we see in Raina's case, we can see the breakdown and the impact of that, right? Racism and implicit bias. they dismissed her, right? They told her she was having a panic attack. They didn't take her pain seriously. So that's that part of it. The hospital where she tried to go and get the COVID test, severely underfunded, right? So we see that it come to find out, didn't even have a lot of COVID tests to distribute. So the underfunding of the hospital. Raina's sister worked as a nurse because when they were trying to determine where she might have contracted it at, she works as a nurse. So we know that frontline workers were bringing it home to, to their families, unfortunately, because they were on the front lines. And we know that Black and African American account for 30% of licensed practical and licensed vocational nurses. So that when we carried the brunt of that. And she lived at home in a low-income neighborhood in a multi-generational household. So all of these factors influenced her death. So I have to say that and really emphasize that because we don't live in isolation, we have to have, as educators, as practitioners, we have to have an understanding of Black women and girls. And, I'm of the staunch belief that a medical professional not only treats a patient, more so, they are treating the patient in a social and cultural world that has ascribed meaning to their body. And you can apply this, across the board in education. As a professor, I'm not just dealing with this student, I'm dealing with the student who's coming from a specific social and cultural world and dynamic. So in closing, I would just say that there's always going to be facts. There's always going to be figures, but they're not always going to be the stories. And I think it's incumbent upon us to really think about the stories we tell, including the stories we tell ourselves, because if you don't tell your own stories, someone else out there will tell your stories. And you can see the benefit of relating stories to make a bigger point about something, right? So like I said, these women didn't know each other, but I'm able to connect their stories and make a larger point about the state of Black women and Black girls in this country. Thank you.
Dr. Ferdinand, thank you so very much. That's valuable and vital and critical research, and thank you for your expertise in your work. Now, I'm sure there are a lot of questions and comments, a lot of rich and valuable material for conversation's sake. So I want to open it for questions and comments from those in attendance. You can also place in the chat your questions or comments for Dr. Ferdinand, and we'll take those now.
They can't put it in the chat. They have to put it in Q&A.
Oh, Q&A. Oh, I'm sorry. Put it in the Q&A section if you have a question or comment that you'd like to offer. I'll go ahead and begin as others are getting those together. Your work, expertise and work around narratives and stories and the linking between Black girlhood and Black motherhood. How do we get those to actually change the practices and institutions within hospitals? Because we've worked with hospitals and been done studies through different foundations and the like, and so how do we get those before those persons, those bodies, those legislators in different, particularly at the state and local level, to actually to get them to care? Because people have made the whole politics of care a sort of as if it's a bad and insignificant matter, and particularly in this hostile environment. So what would you say to us, and how would you advise us in that way?
I think, that it's a difficult thing, because I have to say, even though I write about these kind of things, I have these experiences. And so I write about these kind of things that have happened to me, even though I still go to different places and I'm lecturing and I'm talking to people about these things. I think one of the most difficult things is, for me as an educator, getting these things in the educational system. When I've reached out to schools and I've lectured at schools and all kind of programs, there's reception in the audience, right? But then you always want that thing to translate to something. right? I don't want to just come and say this right here. I need this to look like this here. And so I think that that's the hurdle. I think that's the most difficult part. What has been comforting to me is that, like, especially recently, especially dealing with Black mothers and the mortality rate, we're seeing a lot of interest now. Like, we're seeing a lot of programs that are addressing this in, especially in educational settings, like in healthcare programs, health studies programs. I'm seeing that. So now they're seeing it, but that's not uniform and that's not across the country. It's like small impacts. And so I think for me, what I look for is if I said something in here today that makes someone think something differently, that's my goal, right? Because it can be very difficult when you're trying to change a system that has been in place for centuries. It's an uphill battle. I must admit that.
Well, I think I don't know if it's a question or concern for me. I think it's a combination of both. Great presentation. As an African American woman, one of the things that I see a lot is, people think that, because, as educated African American women, that you're not dealing with the issues that everybody else is dealing with, and not realizing that you're dealing with twice as many issues, because, society is looking at you different. And then you have a community that's looking at you different. And so when we go in the hospital and present with any number of things, for you, you talked a lot about COVID. And we know the disproportionate impact of COVID. Even when they knew that something was available, it was being denied to our community. And so even when they knew that medicine was there and it was literally saving their community from death, our community still was being denied that medicine. And I received that medicine only because enough people knew me that I would go to the media. And I'm like, look, and I went straight to my Facebook page and told everybody what medicine to go and request. Like, this is what I need you to go to the doctor and request. And so, for us, is in this time of what we've seen, this whole political dynamics that are playing out, and we know that we will be disproportionately impacted in the end by all of these different policies. What are some of your advice that you would tell to communities that are looking at it and saying all of our gains have been lost, and what is the reason for us to continue fighting?
Yeah. Yeah, you raised some really good points. I had another piece prepared that kind of hits at what you're talking about. Especially because in the first part of what you're talking about, people do assume that we don't experience certain things because education and class and things. It may provide a buffer on some certain things, but it is just as raw, for us as others. And the other piece that I considered sharing was a piece called "Which Way Is Up," and it uses Melissa Harris Perry's idea of the crooked room, because she says that Black women are so bombarded with these stereotypes that you can never stand straight up, right? You're in a crooked room, you bend and you tilt. And I know over the years I have bent and I have tilt, because just being in academia, yeah, so there is a perception that we don't suffer, we don't have this kind of experience, when in actuality, we most certainly do, and even on a heightened kind of level with that. I think especially after this presidential election, that a lot of Black women, and research has showed that a lot of Black women were, I should use the word, well, we were angry and upset and all of those kind of things, but we were also like, we needed the rest. There was a National Black Women of Rest. I think it was in March, because we were disillusioned by this. And so some of us, I think, felt, and I've had colleagues that were like, oh, this fight is going nowhere, right? And it is so hard to maintain your energy for a fight that seems unachievable, right? A goal that is just so far out, a fight that is immense. I think the only thing that I know for me, it's been finding that thing that keeps me fighting, finding that things that keeps me writing. And when I look at and read about what's happening with Black women and girls, I often get discouraged. Like some papers I don't want to write when I see like, ooh, we have this, we're suffering from this, we're dying, we have, educational problems, all this kind of stuff. It is discouraging. It is discouraging to say the least. I think what keeps me going is this thing in me and knowing that there's a generation coming behind me. So even the subtle things that I feel like I can do, I'm going to do it. And even if sometimes it is literally putting my body on the line, it is. But I'm coming from the understanding that someone put their body on the line for me. I'm standing on this person's shoulder. So what is it? I can't quite give up on this fight, not right now. But there are moments where I'm like, got to take a break from the fight, right? Because even in my own self-care, it can be consuming when you're passionate about correcting and addressing and confronting a system and speaking truth to power, but it can be exhausting. And so I would encourage people to find that thing. It has to be a personal kind of thing, and everybody's thing can look differently, but you're going to have to find that thing that says, I got to keep this fight going, even if it's just a little bit longer, or even if I got to change this fight. Like, so for example, being the head of the African American Studies Department, as you know, we're under scrutiny, I would say, from the whole, administration and the cuts and the funding and all that kind of stuff like that. And what I've done is to say, okay, I'm going to be proactive instead of reactive. So let me shield. What are the things I can do now to shield this department? And then in that, I started creating more courses. And one of the courses that I just created is called Black Girlhood. And I went through the whole process, and it was a tedious process of getting this class established. For me, that was one of the things I can do. I can't do all these other things, but what's in my purview to do, what's in my power to do, is to create a class that's going to address a bunch of issues. And there's going to be one person in that class that's going to be able to take what I said and do something else with it. So I think I come from that kind of philosophy because that has really what has sustained me.
That's great. No, Lee, thank you. Lee Green says, thank you for your accurate description of how we were impacted by the COVID pandemic. I worked in public health. She worked in public health at the time. And she said, your concept of the social terms of health are spot on. The story cannot be told enough. And she just says, thank you again. William says, has there been much progress in the past 20 years? And also says, much of it, has been talked about several times since becoming affiliated with SPAN Ohio, which is a group that in Ohio, organization Ohio, that we oftentimes work with as well. So what would you say to some of those comments and questions?
Oh, yeah, I think what we're seeing now, like even when I was doing the research about Ohio, I saw like, wow, there are a lot of commissions that have started now. The Commission on Black Womanhood and their research collectives. There are a lot of right now like grassroots organizations that are working to address a lot of these issues. And so I applaud them, and they have strategies, they have recommendations, and they're working from that. And I saw that specifically in Ohio, and I think each state may have, because some of the organizations, the Black women organizations, are nationwide, and so you can get involved in those kind of ways. But I think it's if we're going to have to think about how we're defining progress, right? Because some of the research is showing that the rate of, let's say, Black women dying in childbirth is at an alarming rate now. That doesn't mean it was an alarming rate 20 years ago. So I think we're going to have to think about, and even the things that are occurring now, right? And it made me also think about, to go back to the previous point, race and the class issue doesn't exclude Black women from those things, right? We know Serena Williams almost died in childbirth. We know what Beyonce went through childbirth. Like, so it doesn't necessarily exclude you from that. But I think when we're thinking about some of the things that are coming up now, like the organizations, we know that Black women were at the helm of Kamala Harris' whole presidential campaign. So we're still there and still active and still doing all these things. But I think of looking, if we're going to look at, take a realistic look on what our expectations are, in the near future, we may have to adjust, especially it does matter who's in power with this administration. So those kind of things we have to factor in.
What do you think? Where do we go from here? I mean, what do you think's next? Because there are a lot of conversations, there's a lot of good work and scholarship. And you mentioned there are a lot of Black nurses and midwives, and there are a number of different organizations that have formed. Uh, is there some greater level of mobilization organization that we need to do aside from presidential campaigns that can, that can marshal this energy, this incredible energy and creativity and ability that we have within our communities to be able to get greater attention and actually more than attention, get greater work being done on these issues, or find ways to get ourselves in those positions and create those pipelines of greater connectedness. So what can you say to that?
I think we should be connected to each other, even if we're in different states. And one of the reasons why I say that is because when these attacks for African American studies started coming out under this administration, one of the things I thought of is that I'm not in this fight alone. There has to be some HBCU that's doing something. So my initial thing was, let me reach out to see what they're doing, because I would rather not do double labor. And I would think the impact is stronger if we're, working together to confront this thing. And so one of the things that we've been doing my school is in a CUNY system, the City University of New York. So there are, I think 20 something schools in this system. And one of the things that the Black chairs of the African American Studies departments across this CUNY system we came up with certain things that we all needed to do to have a united front. One of them is like offering more, make sure we offer those African American history, African American culture, making sure we offer those every semester. Put it out there every semester, even if they get canceled, offer it. It has to be there. And offering those sections, saving seats for students who are not technically at our campus, but are at other campuses. And so it was that kind of united kind of thing. So I think a lot of what it seems that when I was reading some of the things that the organizations in Ohio are doing, like the Commission on Black Women and Girls and things like that, it seems like that kind of thing may be taking place in other states. And I wondered, are they connected so that this impact can be even larger and the labor doesn't have to be so strenuous on one organization?
I think part of the work with those commissions is that we have to be very careful, because a lot of times when those commissions are established by city council, they are at their beck and call. And so what happens is the issues that we really need to bring forth kind of get a backseat to the political playground. And so the policies don't carry there aren't policies that go along with these provisions. So you create this commission with no policy. And so for me, the intent is no intent, because if there is no policy to help change the conditions of the community, then what was the purpose of creating a commission? So we see a lot of these commissions that are created that I consider just garbage. I look at, the ability for them to carry out their work relies solely on it. And so the Northeast Ohio Black Health Coalition is the organization that does speak up for the community. So I don't have to have a filter. I'm not owned by any of these folks. So, and so what we do is we look at, some of the things that happen in the city. And beginning of the year, my team that's heroes that, they were not acting on the issues around healthy foods. We asked for a menthol ban, a menthol and flavor restriction ban, because of what was happening and what is continually happening in our community. We asked for fast food restaurants to offer a healthy menu option in a children's meal, particularly a salad, because we know that if that option is offered, that poor families will more likely take that than fries, and that there is a health value to having that. We know the conditions around lead, and the fact that we have lead poisoning legislation that we created. The Northeast Ohio Black Health Coalition was one of the writers, that it has actually been deteriorated to garbage. So when they passed it, they passed such a watered down piece that they took all of the teeth out of it. And so it's you left a puppy to try to fight a fight with a pit bull. And so we have communities that are hurting because of, not because we don't have the political prowess, we don't have the political insight. So we have people who fight petty politics. And so the petty politics is that communities, poor communities, can be represented by people who look like them in their communities. But when they become the elected, they forget about the communities in their efforts to be able to get dollars from Republican controlled hands, which is who controls our dollars in our inner cities. So our inner cities, and the conditions in our inner cities can't change the way we think they can change. And that's because the political people that we put in, when they come in, they're at the will of Republican controlled money. So they need those monies from those businesses in order to support the larger efforts in the community, like building stadiums off the back of poor people. And so instead of putting money into some of these other efforts. And so for us, it's, how do we make sure that the political will is indeed the will of the people?
Mm-hmm, mm-hmm. The what you're saying, I understand completely what you're saying. That policy makes a difference. As some of my work in when I've gone into high schools and I've talked about and lectured about these experiences that Black girls have in school, and then, right when we were leaving, I would ask, what's your policy on this? Right? Is there a policy that says that you can't suspend this girl for wearing her belt like this? Like, what's the policy? Is there a policy that says she can't wear her hair like this? So what you're saying is exactly right. The policy of things matter. And another thing that you're reminding me of is, you know, and I find this amongst a lot of people in academia, especially, there is a lot of talk, and people can do a lot of talk, but on the ground boots actions, that sounds like what you're doing in your organization. That's the daily life. That's the thing that affects the daily life of someone. And so I come from that kind of thing too. There is a lot of talk and people can say a lot of things, but the on the ground action. And so, in my role here as the chair of African American Studies, when people are coming to us and trying to get us to sign up for this cause and sign up for that cause and sign up, at the end of the day, I'm asking, what's the result of this? Right? Like, how does this manifest in life? What does this look like? What is this experience going to be for the students? Like, I don't want to hear a lot of talk about this, but what's the connection to the tangible thing, right? How is this going to show up? And so you're exactly right in everything you're saying.
I think
So,
that may
so
be
Dr.
all of
Williams has
our
had,
questions and conversation. I think we could continue so much. Just want to thank you so very much. I mean, you are phenomenal, and your work is so valuable and so
you
relevant.
are.
Thank you
So
for having me.
oh, it's good to connect again, but I'm so grateful that you're able to be here for our organization, our executive director, and her great leadership, and our colleagues and those who are watching. So hopefully, maybe at some point we can continue to work and collaborate in some way because your work is needed and valuable everywhere. So wish you much continued success in everything you're doing. I want to thank everyone for attending. I thank our executive director. Ivanka, for allowing us this platform to be able to do in this space what oftentimes we cannot do as freely in the academy. So, and we're glad to be able to connect those pipelines and areas because we need each other. We need to connect with one another. So, just grateful and just thankful, and look forward to connecting with everyone again next month. We'll have Dr. Sheila Foster, who will be speaking, one of our speakers on climate justice at NYU, and then there'll be other speakers in the months after that, and then leading up to our summer virtual conference on August the 8th, all-day conference. So we'll be in touch with you about all of that, and wish you all the very best, Godspeed, and have a great afternoon, great rest of your week. And Dr. Ferdinand, best wishes to you.
Yes.
Much
Thank you.
success.
Thank you, Dr. Ferdinand.
Bye. Have a good day, everyone.
You
Take
too.
care.
Bye-bye. Hold on, let me cut off the feed.
Yeah.
Back. Give me 1 second.